Knowledge Check 2. Which of the following statements is true about ECG leads? A. ECG leads provide precise anatomic information about coronary artery blockage. B. ECG leads that see approaching ventricular depolarization waves will have upright QRS and T configurations. C. Limb and chest leads may be interchangeable. Or D. Standard ECG lead placement should never be altered. The answer is B. ECG leads that see approaching ventricular depolarization waves will have upright QRS and T configurations. The normal directional flow of electrical current from the SA node, AV node, bundle of His, and Purkinje fibers is from the patient's right upper chest downward diagonally to the left. This phenomenon is best illustrated by looking at limb lead AVR and its opposite, or reciprocal, limb lead 2. The PQRS T-wave complex is upside down in AVR because the electrical discharge is moving away from that lead, whereas the PQRS T-wave complex in limb lead 2 is upright and a mirror image of AVR because the electrical discharge is heading toward that lead. We can see here that the wave of depolarization travels from the SA node downward diagonally to the left. Therefore, the PQRS T-wave complexes are upright in limb lead 2 and inverted in the opposite limb lead, which is AVR. Question 2. In lead 2 on a normal ECG, the QRS complex and T-wave will appear A. Flat, B. Inverted, C. Upright, or D. Enlarged. The answer is C. Upright. This is because limb lead 2 sees the approaching wave of electrical discharge. Therefore, all elements of the PQRS T-wave complex appear upright as noted above. Question 3. Using only 4 skin electrodes for limb leads, how does the ECG produce 6 limb lead tracings? A. The 6 limb lead tracings include 2 from chest electrodes. B. The computer generates additional leads in the tracing. C. 2 of the 6 leads are duplicating. D. 2 leads are artifact and can be ignored. The answer is B. The computer generates additional leads in the tracing. The tracings in the augmented limb leads AVR, AVL, and AVF are generated by the ECG machine and were first theorized by Willem Einthoven. Willem Einthoven was born in 1860 and died in 1927. He was born in Semarang on the island of Java. After the death of his father, a physician, the family returned to Utrecht, Holland, where he pursued studies in medicine. As professor of medicine at the University of Leiden, he was awarded the Nobel Prize in Physiology and Medicine in 1924 for his pioneering research in the electrical properties of the heart. Using a string galvanometer to measure the heart's electrical activity, he produced the first electrocardiogram. Question 4. Limb leads view which anatomic area or areas of the heart? A. Right ventricle only. B. Left ventricle only. C. Both ventricles. Or D. Both atria only. The answer is C. Both ventricles. Here is a visual representation that can help illustrate the point. And 2. View the left ventricle. Limb lead 2 views the apex or inferior wall of the heart and therefore sees both portions of the left and right ventricles. That is why the arrowed line crosses the lead. Lead AVF and 3 look at the right ventricle because of their positioning. Question 5. Chest leads view which anatomic area or areas of the heart? A. Right ventricle only. B. Left ventricle only. C. Both ventricles. Or D. Both atria only. The answer is B. Left ventricle only. Chest leads look exclusively at the left ventricle, in particular the septum, V1 and V2, the anterior wall, V2, V3, and V4, and the lateral wall, V4, V5, and V6. Of prime importance is the anterior wall, comprising the bulk of the left ventricle. The left anterior descending artery supplies this region with blood. Blockages of this artery are the most serious and have the worst prognosis, thus the nickname the Widowmaker.